right. Hey, Waxahachie. This is Heidi Hood, the marketing manager at the Waxahachie Chamber of Commerce, live here with you today. We have Noelle from Discovery Point Retreat, and we have Casey Cheshire is how you say that name, right, Casey?
Cheshire, close enough.
Cheshire.
Like a cat.
Like the Cheshire Cat.
With Ellis County United Way, and we're here to address some important topics regarding mental health and wellness as it pertains to COVID and the impact it has had on Ellis County. So I'm going to toss it to Noelle, if you will, just kind of introduce yourself and we'll go from there.
Yes. Hi again, and welcome to Discover Community Connection. So every week we're here to offer mental health and recovery support, but most importantly, what we're wanting to do is offer connection in our community, because connection's what drives meaning in our lives, and what better way to begin connecting with our community than learning about those who make it happen and who are making it happen right now. So with us today is Casey Cheshire. I hope I'm saying that right. He is the Executive Director of the United Way. I'm thrilled to have you here. Thank you so much for taking some time to talk with us.
Hey guys, great. Yeah, I'm glad to be here. Heidi, Noelle. Thank y'all for coordinating it. It's awesome.
So what I'd like to start with is just giving people kind of a general idea of the United Way and what it is you guys have been doing here in the community for those of us who don't know.
Well, our history goes back quite a bit here in Ellis County. We're celebrating our 72nd year of existence, so we've been in operation for quite some time. And our mission statement is very simple, but we fight for the financial stability, the health, and the education of our community members. And we do so in several ways. Probably one of the more familiar ways that everyone knows about the United Way is probably from the fundraising and obviously the granting side of the work that we do United Way. We also coordinate volunteers, and then we also do advocacy work on policies or any legislative actions that might be undertaking just on a local level, a county level, but also on the state level as well. So those are kind of our three overarching areas. And for us here in Ellis County, one of the things we really strive to do is work with our community leaders and our county leaders to identify where are the needs and the gaps in Ellis County, and then how we strategically connecting the resources and the volunteers and everything else to again help those individuals and families when they come into a time of a need. So and yeah, a lot of people probably heard about United Way, but don't always understand how we do the work. But that's just kind of a quick I guess synopsis of how we accomplish the work here in the region.
So as Executive Director, sounds like you have your plate full in terms of overseeing all of that.
Yes, that is probably the understatement of the day. Yeah, there's quite a bit of the work that we do. It typically kind of runs in cycles, honestly. I mean, we definitely have, the fall time frame is typically, when you think United Way, you think of the campaigns. That's when we're really into heavy campaign season and doing the fundraising initiatives. But typically we spend a lot of, other times of the year focusing on more of the advocacy standpoints, and then, again, working with our communities of looking for those gaps. So it's quite a bit, but yeah, we, as executive director, we're relatively, we have a staff of 2 at our United Way West Ellis County. We wear many hats. So any of the, you name it, the financial piece, the HR piece, the marketing piece, you name it, we do it all. So yes, I have a lot of roles that a lot of hats that I wear as executive director.
So, Casey, real quick, Noelle, speaking of hats, I think the headpiece you're wearing is buzzing a little bit. If you want to adjust it, I'm not sure, but we want to catch everything you're saying.
Okay, there we go. Is that better?
Yeah.
Yeah.
This is one of my new toys as well. Now as we enter in this virtual world, I had to get this hefty little headset, so I hope y'all like it.
Yeah, I mean, it looks cool too, which really adds to the whole effect, right?
That's right.
So you're talking about filling in gaps. I cannot imagine as COVID-19 hit, and you guys are now trying to serve the community in a whole new way that maybe you hadn't anticipated before. Tell us a little bit about now what that looks like, and, kind of what you're seeing in the community.
Yeah, I mean, you think about the last 8 weeks of just how life has changed for everybody. I mean, we were kind of in the beginning stages of just kicking off a few smaller campaigns that happened in the spring with Baylor Scott and White and Atmos Energy and a few of those. And then, I mean, literally overnight, all of a sudden, we just get into a really just a prep mode of trying to engage our particularly direct service nonprofits and our community leaders, just getting them prepared for just the influx of calls that they're going to be receiving, knowing that obviously the health and the safety is of the utmost importance, and we want to do the precautions and listen to the CDC, World Health Organizations, our county, local health officials, all those people, but knowing there's an economic fallout that's going to come alongside that as well. So, we went very quickly on organizing relief funds to obviously support some of our direct service nonprofits all throughout the county. One of the things that we quickly kind of rallied behind or just tried to kind of bring in is we realized the value of collaborating together during this time frame. So we started actually putting together a weekly call with our community partners from the health sector coming in on that one, from the chamber networks being involved with that, all the direct service nonprofits, some representatives from the Waxahachie and Lothian projects, from the churches, getting on a weekly call so we could all talk about what we're seeing, what's going on in the communities, what resources we have available right now, and then how we're strategically going to be working over the next few weeks, the next few months, kind of coming off a recovery from COVID. So yeah, I will tell you, right after spring break, I mean, life changed for everybody. And I think, not only, professionally and work-wise was it going crazy, but y'all probably hear my kids in the background on the playground. But, all of a sudden we have 3 kids at the house, too, that we're trying to make sure they're getting their schoolwork is done as well. So it's been a little crazy on all fronts.
What kinds of needs have you been hearing from these meetings you're having, from leadership all over the community? Can you tell us, boots on the ground, what it's looking like?
Repeat that one again. I was telling my daughter to go off the front porch. I told y'all this was a new world for us.
It is, but I kind of love it. I wanted to know about what kinds of needs you guys are actually hearing out in the community, because, I mean, you really are hearing it from every aspect, from business, from substance use, from mental health, spiritual needs as well. So what is that looking like? What boots on the ground, what kinds of things are you seeing?
Yeah, honestly, it continues to evolve every week, and it seems like there's certain things that are elevated at different times. I mean, honestly, the last probably 2-3 weeks, we've definitely been hearing, the need from obviously when you think about it this standpoint, most people are one missed paycheck away from a financial crisis. And, right now, stimulus checks came kind of a few weeks back. This is the beginning of May, so people are really starting to feel that kind of grind now. So they're starting to realize, okay, this is getting real. We've, either we've been temporarily laid off or furloughed or whatever that might look like. And so the struggles from a financial standpoint are real. I feel like right now, it seems like for the access to the food, I think is at a high level right now. I think our food pantries are rallying together very well. North Texas Food Bank's coming into support. Our church networks are stepping up to provide that. The school districts are providing the grab-and-go meals. So, I mean, they're performing at a high level there. I think the rental assistance has been a big opportunity and big need going on. Our senior communities being now not having access to the senior centers, not being able to have the touches that they might have with Meals on Wheels volunteers has been hard. They feel isolated. They feel alone. They're not able to have those connections and those relationships. And yeah, they might be getting phone calls, but that's different than typically what they're used to and what they probably desire. And then I think people, as they've been trying to self-isolate and trying to be at home, just there's a lot of just like kind of what you guys we're talking about here today. There's a lot of that just we're all taking this different. There's a lot of emotions that come into play. We're all dealing with this in different ways. Our mental health comes into the picture here, and so that's definitely been a concern that we've been hearing, specifically over the last 2 weeks.
So it sounds like that our community has really pulled together in some unique ways. That has to be just an overwhelming sense of pride, at least, that in all of the chaos, I mean, everyone's throwing their hat into the ring and really showing up for each other. I've just seen that over and over. What has been the reaction on your side from your staff in terms of the support they've gotten from the community?
That is, out of all this, I will say that, there is some positives that have come out. I mean, I know this is sometimes, it's hard lately to focus on what's going on from the good standpoint, but to see the community leaders, our nonprofit leaders, sometimes putting their business cards to the side, coming together, collaborating together, talking about, okay, we know we've got so many people in their need right now. What can we do together to better serve the residents in Ellis County? That is encouraging. It doesn't happen naturally, and it's taking some people to step up to the plate to help coordinate that, and it's been just amazing to see that cohesiveness and this connectivity during these times, because honestly, I don't think we could emerge from this any stronger than before if we don't do this way. So I mean, that's been kind of a method that we've been pushing out over the last few weeks, is that we're stronger together, and
yes.
we use hashtags on that on everything. So you've probably seen that. We've even got a cool running medal that we came out that's got stronger together on there. But I mean, that's what it's going to take for us to come out of this stronger than before. We're going to need to all rally behind each other, support each other, and know that, again, we're going to pull through.
So that's the good side. What about your obstacles? Like, what are some of the greatest obstacles that you're facing right now that you're seeing in the community, especially with regards to mental health and families and the kinds of needs that you guys are needing to serve?
Well, obstacles is things are changing like daily and hourly, so just keeping up with that one. And also, I guess it's just, specifically on the mental health, it's making sure that we are, bringing the right resources to the table here, because I think people are realizing that, okay, this is taking a toll. We might not even realize it, and there's a sense of, there is a sense of mourning to an extent of how we deal with this. I mean, there's different stages with that, but sometimes it might even be a denial stage. Sometimes it could be mild stages of depression and what that might look like. And so just realizing that early on, knowing how to connect to the resources during this virtual time frame, and pushing back the stigma of knowing that we're all dealing with this. And it could be and you think about the impacts, mentally of what we're dealing with. It could be again, we're dealing with a loss of jobs, or maybe it could be someone that's sick that we know personally, or a loss of a loved one. I mean, we've had, unfortunately, some local deaths here in Ellis County. It could be the fact it's just a change of a normal routine. We're not able to get outside. We're having to juggle having 3 kids running around in the background of virtual meetings while we're trying to get work done. I mean, it's all this stuff that we're struggling and dealing with right now and trying to figure out what a normal is. And so it's okay to feel sometimes a little overwhelmed, or just like, hey, you know what, I need to reach out to someone. I need to talk to someone. So I think right now the obstacle particularly there is, how do we connect individuals to the resources that are available to help them through these times?
I know you've said several times, even in this conversation, that things are changing daily. And I can't imagine, starting to head in one direction and then going, oh, no, wait a minute, the A, B, and C has changed. We're heading in this direction. So how are you projecting into the future that we're all going to come together with this constant change that's happening, that is creating a lot of mental health distress for everyone? I mean, you've said it eloquently. So what are you seeing into the future as we move forward?
Well, thankfully, we have some great community partners and even statewide partners. We have United Way State Association that we heavily rely on to help us connected to obviously the changes that are going on there. But I just think it's being continue to stay informed, continue to pass that on. Particularly to the, we have some amazing organizations that are what we call United Way partners. They're financial grantees. We help fund their organizations, and we help rally behind them and support them and their groundwork. But we've obviously broadened that. We want to bring in all of our community partners that are right now filling that need. So making sure that we're connecting them to the resources is important during this time frame. The methods of communications and how it's changing, making sure that we're passing it on in an efficient manner so that way they're not having to go find it themselves. And so that's been a big thing for us as well. And how do we adjust to those obstacles? I mean, that's, you take it honestly, we're kind of forecasted even going, into our fall standpoint of how do we start changing the message, knowing that we might not be going into some of our big distribution centers because of just the health and safety measures they're having to put in place, but do we have to rely more on technology and these kind of virtual meetings or video message, whatever that might look like. So I think we're all having to get a little creative as far as how we delivering those messages and how are we connecting folks to resources and getting them on board to our objectives and goals of helping people navigate through this crisis. So it's constantly changing.
As we close out this conversation, I want to make sure people know how to contact you, know what specifically to contact you for, this need or that need. Can you identify those things for us?
Yeah, as far as just my general contact information, you guys are more than welcome to reach out to me anytime. Our website's uwwec.org. So again, it's United Way West Ellis County, but uwwec.org. Phone number is 972-723-7520. But, if you're interested, obviously, in making contributions even to our COVID relief fund that we've set up here in Ellis County, we've already raised over $30,000 on that one. We are consistently pushing funds out right now to our direct service nonprofits. Those are the food pantries like Helping Hands of Venice, Waxahachie Care, North Ellis Dispatch, Manna House, all these different partners, Salvation Army, that are filling the extra grind right now. So we've been obviously putting a lot of relief into those organizations, but not only for a short-term time frame, we're starting to kind of focus our efforts on midterm recovery efforts and then long-term recovery as well, because we know the economic fallout is going to, far reach even the next month or two. It's going to extend probably through the rest of the year, if not into next year. So we're trying to rally now about what can we do to support our Ellis County nonprofits navigate through this crisis. So, any financial contributions, we're definitely going to be good stewards of that and put it to work where it's most needed right now in Ellis County. And then volunteer opportunities. We're obviously always trying to connect individuals to where the volunteer needs are right now. And that's changing as well, because right now there's not a lot of I think of Meals on Wheels is a great example. I mean, they've really done their due diligence of not engaging their volunteers right now, and their staff is delivering only on Wednesdays, and they're not having a lot of people interact with their senior at-risk communities because it's just changing times. And so obviously that's changing as well. And so we're definitely continue to figure out how we can engage, the willing volunteers that want to do something right now, but just can't. But we're continuing to look at those opportunities, and we'll pass those along within our network. Find out. You can also go on our Facebook. We're on Twitter. We do all that fun stuff. We're on Instagram. Okay. So we're trying to push information out as quick as and efficiently as we can on all of our social media channels during this time as well.
So as people are listening, final thought in terms of a message of hope. What is the takeaway here as we move into the future?
Well, it's definitely as I think of, during these times, there's a lot of negativity out there, and there's a lot of stuff that people might see that they might not agree with, or they might think this way on. And what I want to say here is our community workers, our community leaders, our governor, their task force teams, all these individuals, they're trying to do their their best to try to get us back into a new normal. And some people might agree with, businesses opening up. Some people might think that they might want to stay at home longer. Some people might wear masks for the next few months. Some people are excited to get back to work next week and go get their hair done and whatever that might look like. But I just encourage people during this time, we all have a different story. We've all been through different things over the last 2 months. And we're all in different mental states as well right now than we were even 2 months ago. And so I will just say, be slow to judge others. I don't even think that's really necessary at this point. Be kind. Be kind to others during this time frame, because I think that kindness goes a whole lot longer, especially if you think about what we've had to endure through over the last 2 months. And so, if anything, I just want to encourage all to be kind anyways, and just continue to share hope in any of the sectors that you're involved with. So.
Casey Cheshire, thank you so much for spending some time chatting with us about what the United Way is doing for our community. I really appreciate your time. I just want to let our audience know thank you so much for being here. If you are struggling with addiction, please don't hesitate to call 855-916-3289. Discovery Point Retreat is also here to help with any substance use or mental health issues. Heidi, thank you so much. I'll turn the show over to you.
Yeah, everyone take care. Have a good Tuesday night. And like Casey said, go out there and be kind to each other. All right? Thanks, guys. Have a good night.